Hello, welcome everyone. My name is Dr. Ashley Wildman, and I'm here for tonight's Let's Chat with True Women's Health, talking about some of the basics of psychotherapy. So my goal for this Let's Chat is to answer three questions, basically. What is psychotherapy? Why you might want to see a therapist, and the question on everyone's mind right now, how do I find a therapist? And then in true Let's Chat fashion, I'm going to end with 5 tips and 5 questions. And those questions are going to be questions you could ask a potential therapist before working with them. So let's get started. And if you have any questions, feel free to put those in the chat or whatever. I'm not exactly sure how it works, but there are people behind the scenes who are going to help me out with that. I'm going to start with who I am. Some of you guys might know me. I've met a number of you, but this might be the first time you see below my eyes. So welcome. This is what I look like. Oh, yes, we're still using masks around here. Fortunately, we can't spread COVID through the internet, so you get to see my face today. I have a master's degree in clinical mental health counseling. I have a graduate certificate in drug and alcohol addiction. And then I have a PhD in counselor education and supervision. And I was just thinking about this. I saw my first client 16 years ago this month. And so that makes me feel very old. But in addition to seeing clients, I have also taught, trained, and supervised novice counselors. So a little bit of everything. I am licensed in Michigan as a professional counselor. So I'm an LPC. I'll get into that a little bit more later. And I'm currently working with True, seeing patients here for their mental health and wellness needs. So what is psychotherapy? I'm using a very broad term, psychotherapy, rather than talking about counseling or psychology or social work. They're all very similar, so I'm going to talk about psychotherapy, but also I might just say therapy, even though, please know, I'm not talking about physical therapists or massage therapists. We're talking about those who deal with mental health issues. I really like the definition that the American Counseling Association gives for counseling, and feel that it fits with some of the other professions as well. So counseling is a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. So it's very important. It's a professional relationship. It should be empowering, and you're looking to meet some goals. That's kind of the idea of what I'm talking about when I say psychotherapy. In the state of Michigan, there are four different professions that can provide psychotherapy. They are psychologists, which in the state of Michigan also, most places only have doctoral level psychologists. Michigan also recognizes master's level psychologists. Clinical social workers, licensed marriage and family therapists, and then my personal favorite, licensed professional counselors. You can also, in the state of Michigan, provide psychotherapy if you're like a psychiatrist, a psychiatric nurse practitioner, a psychiatric physician assistant. But many of them, because there's such a need for medication, they don't necessarily take time to do talk therapy. So if you're wanting to get more than medication, you're going to probably see one of these other professions. And for the most part, they're really interchangeable. There's some differences in how they're trained, but a lot of times what you're going to get from seeing a psychologist is going to be very similar to what you get from seeing a social worker or seeing a counselor. The one exception I would make is if you're looking for relationship counseling, marriage therapy, family therapy, seeing an LMFT, a licensed marriage and family therapist, is probably going to be your best bet because they're specifically trained to deal with those issues. But other than that, they're pretty interchangeable. The one thing that I would say is what you kind of want to look at when you're thinking about therapy are what I call the ABCs. So A is affect, or a fancy word for emotions. B is behavior, the actions you do, and C is cognitions, your thoughts. And so everybody that provides psychotherapy addresses these three areas, but they do it in different ways. And they have different emphasis they put on them. So you've probably heard of CBT, so cognitive behavioral therapy. Of course, they're very focused on cognitions and behaviors. They do pay attention to emotions too. It's just in a little bit different way. So that's what you're kind of thinking about. Like if you want to see who's going to fit best with you, is to think about, is this somebody who focuses on emotions, behaviors, or thoughts, and see what might work best for what you enjoy. So that's a little bit of what is psychotherapy. I know I've just done a really fast job, but I wanted to get through this information as quickly as possible and give you some time for questions and also get to those tips. So the next question, why would you see a therapist? Going back to that definition of counseling that I gave earlier, if you think you could benefit from a professional relationship that empowers you to meet your goals, then you probably would benefit from counseling or from psychotherapy. So that's what I would recommend, is like think about, okay, what are my goals, and will those goals be helped by seeing somebody who's a professional, rather than, if you've been talking to your friends and that's not helping, talk with a professional. So one of the most common questions I get out in the wild, if you will, is, okay, so my spouse or my kid or my friend or my roommate or my parents, they really need to see a therapist. How can I get them to see a therapist? And what I would say is that's not necessarily the question you should be asking. The question you should be asking is, I'm living with somebody who has some issues, and if I'm not addressing my issues in therapy, am I going to be able to encourage them to do that? So what you might need is help living with somebody who is going through something that they could use a therapist for. That's a good reason to go to therapy yourself. So the answer to how do I get so-and-so to go to therapy, you just can't do it. It's very hard to convince somebody else to go to therapy. So take that as an opportunity for you to go see your own therapist. All right, so how do we find that therapist now that we've decided that we need it? I think the bad news is that right now it is really hard to get into a therapist. They are booked and overworked, and it can just be very hard. But good news is that there tends to be 2 times in the year where people stop therapy, and so some openings come up. And one of those times is in the summer. People decide, okay, school's out, there's so much going on, I'm gonna stop seeing my therapist right now. So this is actually a pretty good time to find somebody because there are some openings. The other time is at the end of the year. A lot of people decide at the end of the year to not go forward with their therapist into the next year. So contacting people around December and January can be another good time to find one that's available. So once you figure out, so yeah, just be patient with that. the first thing you need to do is figure out how are you going to pay for therapy. And so if you are hoping to use insurance, that is an option. The other option is self-pay or paying out of pocket. If you're going to use insurance or other work benefits, because another work benefit that some people don't know about is that many employers have something called an employee assistance program. And that can give you anywhere from 3 to 10 sessions absolutely free. Now, there are very few EAP providers right now. They're pretty overworked, but it can be a way to get some sessions. And often, if you see somebody who is an EAP provider, they might also take your insurance. So you'll be able to continue with them using your insurance benefits. So talk with your HR about what kind of mental health benefits you have and see if there's an EAP program and if you used insurance, what that would look like. One thing to know about insurance is that you will have to have a diagnosis in order for it to be covered. So this can be especially be tricky around something like marriage therapy, like who's the person who has the problem that we're going to diagnose and submit to insurance. So insurance doesn't really like covering marriage counseling, even though that might be what you really need right now. And if they do cover it, it's because there's an diagnosis that one of the people has that is covered. So just be aware that that's part of the insurance game, and it is a game and it's complicated. And if you have specific questions about your particular situation, let me know. I'd be happy to help you figure that out. The other option is pay out of pocket, and a couple of providers I just want to let you know about is one is me. I see most active true patients I can see. There are a few different issues that I don't particularly work with well. So I'd refer those out. And then also, while Dr. Bittner has no problem doing a pelvic exam on, a mother and a daughter in the same day, I really have trouble working well with two people who are really closely related or know each other well. So that can be a little tricky as if I'm already seeing somebody that you're related to or really well. But other than that, I do have some openings and I'm willing to see true patients. Another option that's a lot cheaper than me is at Western Michigan University. They have a clinic called the Center for Counseling and Psychological Studies. And what they do there is they have practicum students who are supervised by fully licensed professionals. And they have a sliding scale, and I've never heard of them like running out of openings. Right now they're doing it all online, but I imagine in the fall they'll go back to seeing people face to face again. And they have a sliding scale, and it tops out at $40. So you're not going to pay more than $40 to see a therapist that is young and excited to practice and is getting fully supervised, so they're not going to mess you up too much. All right, so I'm looking at my notes here. I think that's my really basic overview of what is psychotherapy, why might you need psychotherapy, and how to find a therapist. And I recognize that there's a lot of people who have very specific questions that relate to their situation and their insurance. And I didn't want to get into all the nitty-gritty of that. But please, if you want to help with this, I am more than happy to help any active true patients find their own therapist. Okay, so let's go on to the tips. So my first tip is decide how you're going to pay for therapy. Once you kind of figure that out, other things fall into place. 2 is be patient. There are a lot of, like I said, overworked therapists out there right now, and it can be hard to find somebody. So if you're in crisis, let us know and we'll try to help you find something. But otherwise, it might take a little bit of time to find somebody that works for you and you can afford, and that takes your insurance, that sort of thing. Okay, 3, when you are seeing a therapist, don't be afraid to talk about the relationship. If you don't like the way they pick their nose, or you don't like how they talk about politics or something like that, don't be afraid to say something. Therapy can be very great if you're talking about what is going on in the room. So I always encourage the people that I work with to tell me, let's talk about it, because it's going to be a great way to practice having difficult conversations. So don't be afraid to talk about that relationship. 4, pay attention to red flags. If something doesn't feel right, get out. That is the one time that I would say don't talk about the relationship, is if you feel like, for example, this person is trying to have sex with you. Or they're doing something that seems unethical in some way. Get out, get away, trust your gut. And then number 5, please know we are here to help. So not only myself, but Suzanne and Dr. Bittner and the rest of the team here at True, we want to see you well. And so if there's any way we can be helpful in you finding a therapist or getting a good match, we're happy to help. Okay. My 5 questions that I have are to ask when you're looking for a therapist. So I don't remember if I said this earlier, but if you find somebody that you're interested in working with, you are allowed to call them before you meet with me. I'm kind of surprised at how many people just signed up to meet with me. I think because Dr. Bittner says she talks too much about me or something. People just sign up with me. You can talk to people before you meet with them and before you commit to a True session, just to see if it's going to be a good fit for you. So the first question to ask would be, what is your availability? If this is somebody who only has 2:30 every other Thursday, that might not work for your schedule. So find out what their availability is. Not just are they seeing new clients, but will their schedule work with yours? 2 would be, what is your general approach to therapy? Find out if it kind of fits with what you think about the world and how people work. I knew somebody once who went to a therapist, and this was the red flag they should have paid attention to, is that they were a practicing Christian, and the first meeting with the therapist said, "I'm an evangelical atheist." That probably, I see there's the question, and I will get to that in just a minute. So what is your general approach if you find something that works with them? If they're an evangelical atheist, they might not work well with an evangelical Christian. So I'm going to look at the questions here. So out-of-pocket costs for sessions. Here at True, a session with me is $160. That's pretty much what is for anybody who's licensed, what you're going to pay in Grand Rapids. There's a few people who have less than that, and a few people who have more, but I saw that 160 was about what other people were charging, and so that's what we decided to as well. There are some places, for example, the counseling centers of West Michigan, if you are paying out of pocket and you are okay with seeing a, what's that called? Is seeing an intern or a limited licensed person, it would be less than if you're seeing a fully licensed person. So thanks for that question, Sandra. All right, so question 2 is your general approach to therapy. Question 3, what type of client do you tend to work with best? Right now at True, I don't know if it's just because it's women, it's West Michigan, maybe it's women in West Michigan. I'm seeing a lot of anxiety. So I'm beginning to get really good with working with anxiety. But there are some things that I don't work with. So asking people like, do you tend to work with a certain age or gender or those sorts of things that can be helpful to know before you start working with somebody. Number 4, are there any issues or diagnoses you don't want to work with? So that's, maybe they're going to say, hey, I don't work with addiction. And then you're like, well, that's kind of something I'm dealing with. So that might not be a good fit. All right, question 5. This is the good one. This is going to make them squirm. What are you doing to stay current in the field? If there's anything I find that sets off a good therapist from somebody who's not quite so good is that they are continually working to become better. So they said, I've heard somebody say once, some people don't have 20 years of experience. They've had 1 year of experience 20 times over. So what you want is not necessarily somebody who's had a lot of experience, but somebody who's continually growing and learning. And if you ask them a question like, what are you doing to stay current in the field? And they get all defensive on you, that tells you something that you need to know. So those are my 5 tips and my 5 questions. If you have any further questions, please do them now so that we can answer them. But otherwise, I really appreciate this time to get to talk to you guys. And I will be back in October to talk about how to deal with seasonal depression. I've kind of made it so that we are doing it just a couple weeks before the time change, because I noticed that when people tend to get kind of blah and down in the winter, it happens around the time of time change. So we'll talk about some strategies for how to keep your mood up during the winter. So any last questions or comments? Okay, I don't see anything. I forgot to ask Sam and Michaela what to do at the end. All right, thanks, guys. I appreciate it, and hope to see or talk to you guys soon. Bye.